Today, we are diving into a topic that stirs up a lot of conversation. Yes, that bright orange drink that most women dread around 24 to 28 weeks of pregnancy, the glucose tolerance test for gestational diabetes. Now, each pregnancy, I have made a different decision, one that better aligns with my holistic values and clinical knowledge as a pelvic health and orthopedic physical therapist. Instead of the traditional Glucola drink, I am here to tell you that there are options, evidence-based, science-backed options, in fact. Now, in the past, I still did a glucose tolerance test, but not with the bright orange drink. Today, you will learn what other options you can take at a lab that are aligned with most medical models of care. Now, for my first 3 pregnancies, I was in a hospital-based setting, and these are choices that my midwives were very aligned with. You will also learn what I opted for in my 4th pregnancy, which is actually an at-home glucose monitor kit, and why my midwife was aligned with that choice. So I will walk you through why I made that switch, the science behind gestational diabetes screening, and why it is extremely important that we don't skip a gestational diabetes screening test, and the 3 main holistic alternatives available so that you can feel empowered to make the choice that fits best for you. Before we talk about alternative testing options, let's first understand what gestational diabetes actually is and why it matters for both mom and baby. Gestational diabetes mellitus, or GDM, is a temporary form of insulin resistance that develops during pregnancy, typically in the 2nd or 3rd trimester. It happens when the hormones produced by the placenta, like human placental lactogen, progesterone, cortisol, and growth hormone, counteract insulin's effect. Insulin's job is to move glucose, aka sugar, from the bloodstream into your cells for energy. During pregnancy, your body intentionally becomes more insulin resistant so that extra glucose stays in the blood to nourish your growing baby. Our bodies are amazing, aren't they? Now, the problem arises when the pancreas can't keep up by producing enough insulin to balance this natural rise in insulin resistance, leading to elevated blood sugar levels. So why does this matter for mom? Chronically high blood sugar in pregnancy can impact mom's health in several ways. One is an increased risk for preeclampsia, aka high blood pressure and possible organ stress. This can also lead to a higher chance of cesarean birth due to a larger baby size, also known medically as macrosomia. Gestational diabetes can also lead to a greater likelihood of developing type 2 diabetes later in life. Studies show up to 50% of women with gestational diabetes mellitus develop type 2 diabetes within 10 years if lifestyle changes aren't addressed, aka nutrition and movement changes. Gestational diabetes also can lead to fatigue, frequent urination, and blood sugar crashes, which can affect your anxiety levels and just the way that you feel overall from poor glucose regulation. Now, here's the empowering piece here. When detected early, gestational diabetes is highly manageable through nutrition, movement, and blood sugar stabilizing habits. So there's some good news for this, but this is why testing is so important to know if you fall into the gestational diabetes group, and you can thus make changes to help manage it during your own pregnancy. Now, why does this matter for baby? When mom's blood sugar remains elevated, baby's pancreas starts producing extra insulin to compensate. This can lead to macrosomia, or large birth weight, which increases risk for shoulder dystocia and birth complications, or a provider recommending early induction at 37 weeks or earlier of pregnancy, or a recommended cesarean section because of a concern of baby size. Now, that is an entire different tangent that we could go down because baby size on ultrasound is not super accurate. So if recommendations are being made to change your birth plan solely due to baby size, I highly encourage you to have some deep conversations with your provider and to reach out to me with questions. I'm happy to help break that down for you further. But yes, gestational diabetes can lead to an increase in baby size, which of course affects baby themselves, but also mom when it comes to delivery. Now, gestational diabetes in the mother also affects the baby through something called neonatal hypoglycemia. Baby's blood sugar can drop too low after birth because their insulin levels remain high once the cord is cut. So I mentioned that baby's pancreas produces extra insulin to compensate for mom's high insulin levels. So then when baby is born and now they are breastfeeding, they are breaking that sugar down super fast, faster than they should because of this extra insulin that they've created. This then leads to really low blood sugar or blood sugar crashes in baby, which can be not good, right? We want to avoid that. So, and that leads to, baby being kept at the hospital longer, potentially NICU stays. And so it's just very important that we keep an eye on this, right? Now, the final area that matters for a baby is an increased risk for metabolic and weight regulation issues later in life. So if we start off life with this yo-yo insulin resistance, then we can see complications later on in life. Just like for mom, we could see a rise in type 2 diabetes later in life. Now, the good news is that when glucose is well managed, whether through the traditional test of glucose tolerance testing or through more holistic methods, such as using a glucose monitor, outcomes for both mom and baby are excellent. All right, so screening for gestational diabetes occurs between 24 and 28 weeks of pregnancy because this is the sweet spot when placental hormones peak and insulin resistance naturally increases. Testing helps your provider identify early imbalances so you can intervene with more balanced nutrition, really focusing on protein, fiber, healthy fats, and slow carbohydrates. Regular movement and post-meal walks is also very helpful in the body breaking down glucose and stabilizing those blood sugar levels. Now, the traditional approach is the standard 1-hour glucose tolerance test. This is when your provider gives you at around usually your 24-week appointment or a 22-week appointment, and they will say, have this on hand and take it before our next visit. Between 24 and 28 weeks is common, so you may even get at your 20-week appointment to be done by your 24-week appointment. What I've seen in practice is a lot of times they'll give it around 24 weeks and ask for it to be completed at the lab before your 28-week appointment so that they can review it and you are taking the test within that 24 to 28-week time frame. So the nurse will come in with this bright orange drink that looks like it's in a mini water bottle and say, drink this, wait an hour, and then be at the lab to have your blood drawn. Now, if these results come back elevated, then your provider will recommend a repeat 3-hour test with 100 grams of sugar. The concerns many women have, and that I personally have as well, are that bright orange drink has tons of synthetic dyes in it. Now, there are also a ton of preservatives. If you read the label on that, there are all types of things in there where you're like, what is this, right? Now, this is a very one-size-fits-all approach that doesn't always account for real-life nutrition habits, and that too is a huge concern of mine. I'm not typically ingesting 50 grams of sugar or glucola in one sitting, and so to see how my body metabolizes that, whether it can, great, or not, is not very indicative of how my body is responding to the food I'm giving it on a daily basis. So this can lead to many false positives with the standard 1-hour test because our bodies are not used to handling that amount of glucose at one time. So if this is not how you normally would eat, wouldn't you rather see how your body responds to a typical glucose intake? That's the point my new midwife made and one I completely align with, which will lead us to other options down the road of using a continuous glucose monitor or a finger prick method. Now, if you are in a hospital-based practice, as I was with my first 3 deliveries, you still have some options to take the traditional approach, but in a slightly more holistic means, right? So number 1, and this is the simplest choice every woman should be able to make, ask for a dye-free option. So this is what I did with my first and my second pregnancies. Whenever they brought in that bright orange drink, I said, do you have any dye-free options? And thankfully with my first child, the nurse was like, yeah, actually we have a lemon lime option that is clear. And so she brought that in. It was not offered to me as a choice, but thankfully she knew what I meant by dye-free and was able to bring that option in. So I was at least able to eliminate that form of the synthetic ingredients, that there was no more food dye in my test. So I did the standard test where I took it, waited an hour, had my blood drawn, no issues passing it. My second pregnancy, I again asked for the dye-free option. And I remember the nurse saying, we don't have that. And I said, well, of course you do. I used it for my last pregnancy. And she's like, We've never had a dye-free option. I was with the same practice. I said, well, it's your lemon lime option and it's clear. And she said, oh yeah, we have that. So if your nurse gives you some pushback on not having dye-free, simply explain to them it is the lemon lime option. Most all hospital settings, at least in the United States, utilize the same company, the same creator of these Glucola drinks. So they all have usually the same options on hand. So ask for the lemon lime option. If they don't have it in stock, you can ask for when they do, and that you'll come back and swing by and pick it up. You are at least eliminating the food dye in that drink, which is completely unnecessary. Why they need it to be bright orange in color, I have no idea. It drives me crazy. It should just be standard that lemon lime is the option all women are offered in the hospital, and there's no food dye. Okay, so that's easy choice number one. It's not at all changing what you're getting from the hospital. You're still getting it from your medical provider. Everything's standard. Option number two is to take the fresh test instead. Now, some more holistic or open-minded providers are starting to stock this in office, which is really exciting. But I'm seeing that more in the private practice setting and not in the hospital setting yet. So the good news though is that hospital-based providers are usually very open to using the fresh test in place of the 50-gram Glucola drink. If you go to Fresh Test website, which I will link in the show notes below, you'll see that there's different options. You can get a 50-gram option, 75-gram, or 100-gram test. Now, for the 1 hour glucose tolerance test, you want to be sure that you're getting 50 grams and just make sure that that's what the test that your provider uses. That's the most common one, and make sure you order the right amount, right? So 50-gram Glucola drink will equate to the 50-gram fresh test drink. And if you look at the ingredient label, it's just so much more simple. So it's like you're drinking fresh squeezed lemonade pretty much versus a very preservative-laden drink. Okay, so the fresh test works in the same way though, where it is 50 grams of glucose. There's just way less than synthetic dyes and zero synthetic artificial flavorings or preservatives within it. So it's just a much fresher, cleaner option. You're still getting that 50 grams all at once though. You wait an hour and then the lab draws your blood just as it typically would with their Glucola drink. So most hospital-based or medical-based providers are very open to you using the fresh test. This is what I used for my third pregnancy because I wanted just a more natural option. And my provider had zero pushback to it as long as it was that 50-gram amount that they were used to testing. There was no change of what I had to tell the lab. I was just going in for my glucose tolerance test, lab draw, and all was well. All right. So that is something to ask your provider is the fresh test. Again, I will link that company in the show notes and you can take a look. They're not that expensive, but it is a cost outside of, the Glucola drink is just something that's wrapped into your care under a typical insurance model. So, that's one thing to weigh, and just the ease of access for the dye-free drink is kind of why I did that for my first two. But with my third, I planned ahead more. So I knew I had enough time to order the drink, get it in, and take it before I needed to have those lab draws for my provider. Now for my fourth pregnancy, here's what I decided to do differently. So I have always known that another option is using a glucose monitor. So you could use a continuous glucose monitor, which is something you adhere to kind of your tricep area, or you can get a finger prick option, which is what I actually elected to do. It's the kit that my new midwife usually uses and recommends. And you simply do a little finger prick. It's honestly not at all painful. You can adjust the dial to determine how far that little pinprick goes in. So for me, it's just at the setting of 2, which is not very deep. Thankfully, I have really good blood flow. If you stay pretty hydrated, hopefully that's the case for you. And you just squeeze down on your finger, a little blood drop bubbles out. You hold that blood up to this little testing strip that gets inserted into a glucose monitor. And I just hold that up. It reads it for 5 seconds. And then I have what my test score is. Now, the guidelines that my midwife gave me were to, in the morning when I'm fasted, the goal is that my glucose levels read less than 90. I have seen some ranges that would even say 82 to 88 is the ideal range, because you don't want to be super duper low either, because then we can see the glucose want to rebound much higher. So between 82 and 88 is that ideal range, but less than 90 is what you're looking at when you're fasting. After a meal, you then test 2 hours with a finger prick after your meal. So if I finish breakfast by 7:30 in the morning, at 9:30 in the morning, I'm doing a finger prick and I'm getting a reading. The goal is that that level is less than 120. Is again what my provider gave me as the number to go off of. I have seen some ranges as high as 140, saying as long as you're under 140, that is ideal. But we've been going off of 120. I have had some that are more in like the 130 range. So seeing the number of like under 140 is also acceptable. Was nice for me to have that range to go off of. Other times I will be, well under and sitting at 90 2 hours after a meal. So it's just very interesting to see how what we eat impacts real-time data versus just one single high dosage of sugar snapshot that you get with the Glucola drink or with the fresh test. There are also, this helps us avoid any kind of artificial additives, any huge consumption of sugar at one time. Using a glucose monitor allows me to see what my actual meals do to my body. And it's been so eye-opening that I've noticed when I have a meal with more protein, fiber, and healthy fats, that my glucose curve just stays nice and steady. And then I see my fasting glucose looks really good the next morning. But when I have a meal that is finished with cherry pie and ice cream, as I did one night this week, my fasting levels were not great the next morning, and my 2-hour post-meal levels were on the higher end for me. And so it was just very eye-opening and has made me much more conscious of the food that I am putting in my body. So if you decide to go this route, this is much more nuanced, where you really do have to work with your midwife or your OBGYN more closely, because I had to keep a note section in my phone of what my values were. I copy and pasted that into a electronic medical software message with her, like a little chat with her, so she could see what my levels were. She could see, wow, like sometimes you're dipping pretty low and then other times you're a little bit on the high end. Like, let's see if we can make this curve a little bit more steady so we're not up and down so much. And for me, that really meant adding in even more protein to my diet. So even for me, somebody who is very knowledgeable about supporting the body during pregnancy, I saw some not great readings sometimes, it didn't put me in a range where I was said to have gestational diabetes by any means, but my issue is more so hypoglycemia, so low blood sugar, which then sometimes can rebound high. So a little bit more up and down versus being just steady and consistent. And so I think we hear so much about hyperglycemia, which would be the category of gestational diabetes, but we don't hear too much about low blood sugar. And I'm actually finding for me, that was more the issue. I think stress and cortisol has to do with that as well. Cortisol affects how we produce insulin in our body, and so that can lead to lower blood sugar levels as well, which I think is mostly the case for me, as well as needing to get more protein in. So I say all of that to mention I'm learning so much about my body, even in my 4th pregnancy, even as somebody who has been doing this work for over a decade, and to know that you too may find new things about your body should you choose to go the glucose monitor route. So the kit that I got was literally $30 on Amazon. So it is not at all expensive. That is probably cheaper than the amount that I would pay the lab even after insurance covers for that lab draw, because we always get those surprise bills from the lab a few months later. And so when I saw the cost of it, I was like, oh, I have no problem doing that. And it has 100 test strips, so I can use it even postpartum if I'm curious. I had my husband use it a few times just to see how his blood sugar levels were. So it's really interesting to be able to utilize. You do just want to make sure that you are collaborating with your provider on this. So you definitely want to do glucose monitoring with your provider's oversight and guidance and not outside of their care. You don't want to tell them, yeah, I'm going to do the test to the lab and then just not and take this route instead. It's very, very important that you work with your provider on this and choose something that you both feel aligned on, because it is important that we screen for gestational diabetes, as we mentioned, the complications that can arise for mom and baby if it goes untreated. Now, this very much aligns with the approach that I take within the Holistically Well Pregnancy Program. My philosophy really is utilizing your own personalized data choosing systems that are going to help regulate your nervous system, and using movement and nutrition that honor both your body and baby. And so this has just really pulled all of that together as another option for you to understand that you can advocate for yourself with this choice. All right, so to really wrap it up, the holistic screening options that you have. Option number 1, this is the most easy entry option. Choose dye-free Glucola drink. So if your provider wants you to take a Glucola drink, ask for the dye-free option. It's the same glucose concentration, just minus the synthetic food coloring. This often needs to be requested and it is not routinely offered. I utilize the Ohio State Wexner Medical Center midwife group for my first 3 pregnancies, and they had no problem accommodating this. The key takeaway here is that advocacy should be polite, collaborative, and effective. As I had mentioned, that one nurse had no idea what the dye-free option was, but when I mentioned lemon lime, she did. So just ask kindly. You have that extra information in your toolbox, and they should be able to offer that for you. Option number 2 is the fresh test. This contains just 3 ingredients: organic glucose, crystallized lemon, and mint. I mean, my goodness, that's awesome, right? This is available in 50 gram, 75 gram, and 100 gram packets to match test protocols. So let's say you did get a false positive or a positive reading after that 50 gram test and you needed to do the 3-hour option. They also have where you could get the 100 gram packet to match the test protocol that your midwife or gynecologist is ordering through your local lab. These oftentimes do need to be purchased independently and then brought to your appointment or brought to the lab. Most often, this is supported by midwives and holistic OBs. All right. So like I said, even in the hospital setting, I was able to utilize that with my 3rd child. I passed the test. There was no follow-up option needed, but know that if it were, the 100 gram option is there. Now, option number 3 is blood sugar monitoring. This is what I'm using for baby number 4. This is the finger prick method or the continuous glucose monitor that you could attach to your arm. I will note the continuous glucose monitors are more expensive, and that's simply why I just didn't go that route. The finger prick option, I loved that I could just keep it on hand for future uses. It was a very low cost entry, and it's just been so eye-opening. So with this, you get to set your testing schedule. Typically, your midwife or OB will want to see fasting numbers and 2 hours post-meal recordings for 1 to 2 weeks to see how your body does over that time frame. It tracks patterns instead of one acute spike and seeing how your body responds to that. This really empowers women who prefer avoiding the Glucola altogether to still give you a way to track your blood sugar levels, roll out gestational diabetes so that you are honoring both you and your baby's health, but you're avoiding taking anything outside of your normal diet, which is really great. Now, the hardship, I will say, with the finger prick method, as opposed to the continuous glucose monitor, is that I have to remember to do this 2 hours after a meal. And you can imagine that's sometimes hard on days that I'm home with my kids or when I'm seeing patients. Sometimes I'm in a patient appointment and I can't go prick my finger 2 hours after I eat lunch. And so just having that in mind, that you may not get every single reading, but you want to make sure that you're getting enough readings to paint a full picture of how your body is responding to its nutrient intake. All right, my friend. So the functional perspective here is that insulin resistance is inherently bad. We talked earlier about how the body is naturally more insulin resistant during pregnancy to leave some more blood sugar in our bloodstream for our baby to be able to have. It is actually a physiological adaptation during pregnancy. Problems simply arise when the system can't keep up with keeping those levels level, right? And a nice balanced curve versus going up and down or going way too high. Now, as mentioned, nutrition, sleep, and stress all affect glucose regulation. So if you are noticing wonky numbers or you get a positive test after that lab draw, know that you have options to help regulate this holistically. Nervous system is extremely important to keep in mind here. Chronic stress is going to increase cortisol, which leads to a higher fasting glucose. This is something that I mentioned noticing in myself a little bit and having to be very aware of how stress affects my glucose levels from a fasting standpoint. And so having that knowledge has allowed me to make some adaptations that I wouldn't have made otherwise. Supportive practices such as walking after meals, making sure that you are eating enough protein in each meal and healthy fats to balance out any carbohydrates. Prioritizing sleep and grounding breath work are also important practices to help regulate those blood sugar levels. All right, make sure you do not skip testing. I want to hone in on that. It's just important to personalize it. So in no way am I advocating to just not test. It's very important that you do, but I want you to know that you have options to make it more personal to you and a little bit more holistic. Now, pregnancy is full of decisions, some big, some small, but they're all impactful when it comes to you and baby. So whether you choose to take the traditional glucose test, a dye-free version, the fresh test, or daily monitoring like I did, remember, an informed choice equals an empowered motherhood for both you and your baby. So this information is not here to add more stress. It is here to help you advocate for yourself and your little one. So choose decisions that feel aligned for your health. Now, if you loved this episode and want deeper support on nutrition, movement, and nervous system regulation through pregnancy, be sure to join me inside the Holistically Well Pregnancy Program. I will link it below. And I'd love to hear from you. DM me over at Dr. Kayla Borchers and share how you approach gestational diabetes screening. Your stories truly help other women feel confident in their choices. Until next time, take care and be well.